I'm going to kick this too. Oh, so
Sorry.
Okay, all right. I know your real clinic isn't like this. So
Yeah.
Okay.
It's not.
I know. I didn't allow it.
Can I just sit here and my ear?
Okay, so you're going to start off with your basic to begin with right here, just introducing touch. My hands are cold. This is a hot neck right here. Okay. So just introducing touch, seeing what's going on, maybe fading in a little bit deeper. Then you're going to go ahead, laterally rotate, get up, move in for your adjustment. And actually, that did just cavitate. No, I didn't mean to. Of course, the adjustments are out of your scope. But what is in your scope is even that action to mobilize. And it just bugs me. Is it okay if I just pull these bangs back just a little bit? Because I just got to, it's just one of those things that, okay? That's just me. That's just me. That's
if you just want to do my hair while you, that's totally fine.
Okay,
The tools probably work on that, right?
Yeah, totally. Yeah, in fact, you can, if you take them both out, you can actually cut.
If you heat it and curl it.
yeah, okay. All right, so when you're set up here, one of the holds that I like to use, most of us are probably doing this, I like to reach around from the other side, fingertips can come in here, and then I can run down with my thumbs, and you can do your standard movement that you're going to do here. Now, what's the issue? What are we trying to save? We're trying to save load onto our thumbs. Same thing opposite side. Yep. So fingers come around like this.
Yep.
This can be a grip to go ahead and pull up, and then you can go ahead and work with your thumbs down like you're going to move here. All right? Okay. But because I'm trying to save my thumb, which of these is like a thumb? Thumb. The iron thumb. So you can pull that out and do the same kind of a movement where you're over to the side. Fine tune, light grips, not heavy grips, just a light controlled movement. And you can do the same thing where you can follow yourself down the muscle and all the way to the insertion point. A little bit tight right there. Okay. So usually I'll start like this, and I'm just using the soft edge of the thumb to begin with, and this is pretty analogous to the stroke you've seen before. Switch it to your side so you guys can see it. Pretty analogous to the stroke you've seen before, where you're just rolling down like that. Okay, you can trace down to the scalenes if you want. You can go whatever direction you feel is the most restriction that you want to work into. But we're going to change it a little bit, where now I'm actually going to use this to hook in and be very pinpoint specific on the person's neck. So now I can go ahead and fade up and in, and if it's too much, let me know right away. But I can fade up and in, anchor my hand on the table, and you can start to stroke up right there. And how does that feel?
Oh, you're in there.
Yeah, definitely. Yeah, exactly. But I'm not even working hard at all to do this, right? Like we've all had the treatments where you finish your treatment and you like can't even hold a pencil and throw your chart notes out or whatever it is. Like it's brutal, right?
Are you
So, yeah, I'll come back to the side in 2 seconds. Okay, so even right into here, and I'm palpating through the instrument. I'm even using my other finger on the other side to kind of reinforce that, to kind of give myself a little bit more movement. Okay, so for this side, demo of the same thing. Fingers reach around. I can go ahead and I'm just going to be arching up and in like this. This was the same movement that we used for the quadratus lumborum yesterday, but now we're going to be a little bit more specific with it. So you're going to arch up and in, and the same thing. Just going to work my way up and through the tissue, lifting and spreading, not doing nearly as much force on my own hand, and pressure-wise, you're doing all right?
Yeah, it's actually, I hate having my neck worked on usually because it is so tight, but that's maybe a little more comfortable than usual because you're not hitting everything else.
Totally, okay. And then even right here, so if you want to be even more specific, I can actually trace all the way up into those thick suboccipital muscles that you can see right there, and I can follow myself, and again, let me know if it's too much. I can work my way along that inferior nuchal line if I wanted to, superior nuchal line, just small micro movements back and forth, and for you right there especially. Taking a big breath in, all the way out. Yeah, and as she breathes out, you can go ahead and apply a little bit more pressure, ultra specific, ultra deep, okay? All right, so that's my first kind of go-to movement right there. Okay, the next one, what we can do with these, well, you have lots of different options right here. Let's go ahead and just, there's a couple of different ways I can do it. Let me do this. So basically, I'm going to sit with my back right here, so you'll have to be on that side to see it. One that I find works really well, it might be a little bit hard for your neck. It depends, different people will like it differently, but what I'm going to be doing is anchoring my hand on the table and just spinning up into this position right here. And then I'm going to let your suboccipitals rest on there. And then I'm going to take my hand and go just slight movements from side to side and balance that. But where everybody messes this up, everybody wants to hold the head a certain way because you're all used to holding the head like this. Okay? You are all working too hard. You all want to hold like this and then do your action. What I'm going to do is make a C shape with my hand. My hand is going to rest on the table, and then her head is going to rest on my hand. So I don't have to physically lift up his head, right? The next motion is going to be this movement right here until I get to the suboccipitals, and then I'm going to let her head sink in and drop onto that load right there, okay? So the movement is just pronation of the forearm from here, taking her all the way up, and it's nice and light right now. Getting to an angle, well, for her neck, right about there, angling it slightly forward, and then letting her head drop in. And when it's too much, if it is too much, let me know. Okay. So even right here, her head drops down. Still doing good?
Yeah.
So you could hang out like this if you wanted to. Describe what it feels like.
I can feel the pressure, but it's not bad actually. And it feels a little more diffuse, such as.
Yeah, but you can see, you can even feel these small micro movements
Yeah.
here. If
Oh, I
move
can
this way.
feel you doing it, but it's not. It's
Yeah.
not terrible.
Okay, I'm gonna load up a little bit more.
Okay.
Again, you tell me when to stop.
Yeah.
Okay. So hand comes out. So now this is the full weight of her head on it, and you're still doing okay?
Yeah.
Okay.
Surprise, surprise.
Okay, so
I know.
just hanging out there, and if you really want to, so you have someone who can really tolerate it, you can push down on the top of their head and do that same little bit of distraction. Like this is mega force right here for you, and you're doing great.
That's nice.
Yeah.
Oh yeah, I was definitely less comfortable with the idea of that than the actual motion.
Yeah,
That's
totally.
okay.
Okay. Yeah. Okay. So that's gonna be a win right there for you. If you guys got nothing else from this weekend, you just saved your hands for suboccipital work right there. with that, okay?
Seriously, right?
Yeah. Okay, but get used to this thumb movement in and there to start with, this suboccipital movement right here. So those are some of the basics. I've also had some treatments where people have gone over, you can run over masseter, you can run over temporalis as well with these different setups like this.
Oh wow.
I would really watch how much load you actually give in here, but it's something you can do as you get more precise. Same thing up here, you know the temporal fascia is really thick. You can do the same thing and start to work up through the muscle as well up in this region, okay? Again, relatively light with all of these treatments to begin with, especially when you're first learning. Yep.
What is most notable to not do that on that side of the on the side of the face?
Well, of course,
Areas.
it'd be anything that causes significant pain, or the person, like if you see them wincing and pulling back, you know that it's too much treatment. The other
Right.
caveat that I'll give you, if you look at the videos on our website, is I had that treatment done to me, and I actually had a headache for the next 2 days from it, because it didn't feel like it was that bad at the time, but it was just more load than I was really able to take. And the person was just learning, so that's what happened, but they spend a lot of time going through it.
Right.
I'm a teacher, I like to give you as much opportunity as you can. It was just too much for me, so, okay? Is that a question or just a flare of the arm? Okay, all right, so those are some movements that you have right there. I'm really doing this quickly. You are gonna spend a lot more time with this when you do it, okay? All right, contact there, okay? All right, easy. All right, so the next thing is going to be, if you go ahead and you can use this one as well. So there's a couple of things here that really get you up into this. All right, so number one, you're gonna look at this and say, how does this even gonna work, Dr. Nick? This is a winner right here. Carradine up in Squamish, he loves this one. So my grips are over grips. I can do double under grips, whatever you wanna do. But you're ultimately gonna go up, and you're gonna think in your brain, like this is gonna go ka-tunk, ka-tunk, ka-tunk down all the spinous processes, but it doesn't.
Really?
And you're gonna run all the way up, and I'll actually have you extend your head just a little bit for me, that right there, just so I can arch in good. And I'm gonna pull up and in right there.
Is that a good traction?
That's
Yeah.
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 You got the concave
Perfect.
side.
Yep, concave side is going in, and I can lean back with my whole body and do the same thing. Big breath in again. So I take my pressure off, and she breathes in, she breathes out. Follow her up, and I'm just using my forearms against the table just to distract right here.
That's
And
a
how
good-
does that feel?
That's so nice.
Yeah, and you can do micro movements here again, okay, where you're just gonna slide back and forth a little bit. Again, this shape is designed to fit most necks where you can pull up like this or underhand up like that. And you're gonna have to play around with the angle that actually works right for the person you're working on. Now, if you want the ultimate and your way to get deep into the back of the neck, this is gonna be the way to do it, and I'll do it on both sides. So for this side right here, my hands are reaching around again, so I can reinforce whatever contact I make. So I'm gonna push in here. I'm not holding way back here and trying to do it, okay? I'm choking up quite a bit. Finding myself right on the bottom of the suboccipitals, and then I'm gonna go ahead and just traction up. And you'll often see that response because
Yeah.
people are not used to this.
Yeah.
How are you doing? Too much or not?
No, it's okay.
No.
It's definitely
See?
more than the other ones. But it's
Yeah, absolutely,
manageable.
because, yeah, exactly. And so you can see what I'm doing though. Hands are balanced, hands are light in control here. Her head is just relaxing, and I'm just giving that little bit of traction up. Little micro movements, okay? Makes a big difference to this area. And again, there is no part of my body that can give that firm, specific of a pressure over top of any area, okay? When you do this, be relatively light, but it is something that you can do and some really good benefits with patients with. Same thing on this side, choking way up, and you can just see the fingers rolling in to help direct that movement, okay? Take your time. So I'm gonna give you guys each a half an hour to work through the neck right here. Start off with whatever you like, your basic strokes to begin with, your basic distraction. Another one that I'll give you if you want, hopefully most of you are using this already, but it's one of my go-tos for almost every patient. How do I end most visits? Just with this X stretch, right? Where you run in like this, hands in like that. So you reach over top of the anterior part of the shoulders,
Money.
open them up, and then stretch them up.
What?
I've
You guys
never
ever
seen
this
this
before?
before.
Okay, all right. We have a
This
whole
is
joint motion. So
fantastic.
basically the table would be a little bit higher, but I'll be in this position right here. She'll take her big breath in, shoulders open, and then we go ahead and lift up. So you're getting the neck, posterior neck stretched, and you're opening up the shoulders at the same time.
Oh,
Guys,
I
you should have
love
taken
it.
my height before we did
Good.
this.
Yeah, totally.
I think I
Good.
just grew.
Yeah. And that's kind of your go-to winner chicken dinner right there, okay? Oh yeah, this is totally, you're working hard for that distraction that way. Okay,
I just have a quick question.
Yep.
Can you show me the position you were holding it in? So you said you can do both ways. On her, were you doing it the kind
for
of
her it just feels better,
cave
like,
way?
because if you feel I could just feel the way my hands came into the back of her mastoid processes. This just feels like a better fit for me. Sometimes you'll have people, for whatever reason, this undergrip is gonna feel better for you.
Can you show me in the air so I can not,
Yeah.
I don't want to see it.
Yeah, totally. So up in the air like this,
Okay,
or
okay,
up in the air like that.
okay.
The tool
Nice.
is like that though, right? That's what you're asking?
Mm-hmm. Yeah.
Okay.
So the
All right.
contact point
So you
was
made your
on
money's worth
here.
today, that's for sure. Okay. All right. Back to it.